This topical gel is used to treat athlete's foot, a common fungal skin infection that causes redness, itching, and scaling. Naftifine 2% gel is an antifungal medication that works by stopping the growth of the fungus. It is applied to the affected area once a day for up to 4 weeks. It is best to apply it at the same time each day to help you remember. Make sure to wash and dry the affected area before applying the gel. When using Naftifine 2% topical gel antifungals, it's important to only apply it to the skin. Make sure the affected area is clean and dry before applying a thin layer of the medication and gently rubbing it in. Your doctor will typically recommend applying it once daily for 2 weeks. Remember to wash your hands after using the gel, and do not wrap or cover the treated area unless your doctor tells you to do so. Avoid getting the medication in your eyes, nose, mouth, or inside the vagina. If it does come into contact with any of these areas, rinse them with plenty of water. It's important not to use the medication more often or for a longer period than prescribed, as this can increase the risk of side effects. Use it at the same time each day to help you remember, and continue using it until the full prescribed treatment period is finished, even if your symptoms improve before then. Stopping the medication too early may cause the infection to return. If your condition persists or worsens, be sure to inform your doctor. If you experience a mild irritation at the application site, it is important to inform your doctor or pharmacist. It's important to remember that the benefits of using this medication outweigh the risk of potential side effects. Most people using this medication do not experience serious side effects. While it is rare, a serious allergic reaction to this drug can occur. If you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects. If you experience any other effects, it's best to contact your doctor or pharmacist. Before using Naftifine 2% topical gel antifungals, make sure to inform your doctor or pharmacist if you are allergic to it or other antifungals. Also, let them know about any other allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. Additionally, be sure to inform your doctor or pharmacist about your medical history before using this medication. If you are planning to have surgery, it's important to let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. It is also not known if this drug passes into breast milk, so it's best to avoid applying it near the breast area if you are breastfeeding. Be sure to consult your doctor before breastfeeding while using this medication. When using Naftifine 2% topical gel antifungals, it's important to be aware of potential drug interactions that could affect the effectiveness of your medications or lead to more serious side effects. It's important to keep a comprehensive list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your healthcare provider. It's crucial to seek approval from your doctor before starting, stopping, or changing the dosage of any medications. This will help ensure the safe and effective use of Naftifine 2% topical gel antifungals, as well as your other medications. If this medication is ingested, it can be harmful. If someone has taken too much and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call the local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to remember that Naftifine 2% topical gel antifungals should not be shared with others. This medication is specifically prescribed for your current condition, and should not be used for another infection unless directed by your doctor. If you forget to apply a dose of Naftifine 2% topical gel, apply it as soon as you remember. If it's close to the time for your next dose, then just skip the missed dose and continue with your regular schedule. Do not apply double the amount to make up for the missed dose. It's important to store Naftifine 2% topical gel antifungal at room temperature and away from children and pets. Make sure not to flush the medication down the toilet or pour it into a drain unless instructed to do so. When the product is expired or no longer needed, it should be properly discarded. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.